Here's a picture that I think shows a little bit more detail than what we were seeing in the previous slide. The upper airway structure, once again, is that nasal cavity. What we call the nostrils is the beginning, and then you get on up in here into the nasal cavity. And this is up here where we can see turbinates in that nasal cavity. A lot of times when individuals having a nosebleed, better known as an epistaxis, 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 known as a nosebleed, is that one of the turbinates has a blood vessel that's ruptured in it, and these individuals will have pretty bad nosebleeds. We can see the epiglottis noted here in the upper airway. And remember, it's the safety flap that covers the trachea. The lower portion of the airway is what they call the pharynx or the posterior pharynx. And just below the epiglottis, we get into the larynx, better known as the what? Known as the voice box, right? And that's where your vocal cords are located. And remember, the larynx divides the upper airway from the lower airway. So we have the nasal pharynx, which is just behind the nose, oral pharynx behind the mouth or the throat area, and the laryngopharynx, which connects the larynx and the esophagus. And remember, what directs air into the windpipe and what directs food and water into the esophagus is what? Test question. It's going to be the epiglottis, right? Once again, the larynx is the voice box, and it marks the split between the upper and lower airway. The epiglottis, protective flap that closes during swallowing to prevent aspiration. And we can see here there's the diaphragm. It's one of the primary muscles that is responsible for inhalation. It contracts downward and pulls the chest up and outward with the intercostal muscles in the ribs, which is what allows that negative interthoracic pressure for the air to rush from the upper to the lower airways, where oxygen makes its way into the bloodstream and CO2 spills back out into the alveoli. In the passive exhalation, the CO2 exits out into the ambient air. Lower airway structures. We know that the larynx is a very cartilage rich area, and it's better known as the Adam's apple. You know, on some males, you can see it's very prominent. It sticks out. It's the front section of the larynx. And in there, you have what they call the cricocartilage, right? The cricocartilage ring. It's a firm ring directly below the thyroid cartilage. And in between those, you have what they call the cricothyroid membrane. It's the soft tissue between the thyroid and the cricocartilage. Very important that you remember this, guys, because once you become a paramedic and you move in a little bit more advanced, if an individual has a full airway obstruction and you cannot get it cleared, this is the area where you do a cricothyrotomy. Now, I can tell you, being a paramedic over 30 years, thank God I have never, ever had to clear an airway. Um, well, let me put it, I never had to gain or access an airway through cricothyrotomy. I've always been able to either use a laryngoscope with McGill forceps to remove an airway obstruction. I've always been able to clear an airway, thank God. I've never ever had to do a cricothyrotomy, but you'll see on some of these movies, a person's on a plane and they're choking, and some James Bond type of character or MacGyver will pull out an ink pen and they will pierce the cricothyroid membrane between the thyroid and cricocartilage, and they'll create an airway. I always think it's hilarious that, here's somebody done saved somebody with a 99-cent pen. I just love the movies. I guess in theory it would work, but in the pre-hospital setting, once you move up into your paramedic role, you will get a device, transtracheal airway, where you will be able to access this area and be able to ventilate someone to get oxygen in and CO2 out should you need it. Once again, reemphasizing the trachea, which is our windpipe. It's a tube carrying air towards the lungs, and it divides at the carina, and it divides into the right and left bronchi. So if you follow the trachea down, you see it makes its way into the right and left lung. That junction, where I would call it a fork in the road, FORK, a fork in the road, that fork in the road where it goes from right to left side of the lungs, that is called the carina. And once you get into your paramedic level of training, the carina is very important because we as paramedics do a procedure called deep endotracheal suctioning. And when you do deep endotracheal suctioning, you have to be very careful with your suctioning device that you do not get too far past the endotracheal tube, because if you do, you can actually create a small opening there in the carina, and you'll allow air to escape out of that airway into the mediastinum, meaning into the chest. Basically, you poke a hole in the carina, and now that air is escaping through that hole. Oh, guys, let me tell you, that's bad news. You don't want to do that. But I want you to go ahead and put that in your toolboxes, that the carina is where the fork in the road, where you get the right side of the lung and the left side of the lung. Bronchi. Bronchi is continuing on in the lower airways, and you notice the word bronchioles. So when you go from bronchi is larger and bronchioles are smaller. So that will be a test question. Which is larger, bronchi or bronchioles? Bronchioles are always smaller. So we see the bronchi coming on down into the lower airways, making its way. And as it moves into the lower airways, the bronchi now become bronchioles. And they're branching little tubes that transport air to the alveoli. This is these alveoli, y'all, they're very, very small air sacs. They're little clusters, if you will. And the bronchi are actually too big to articulate with the alveoli. That's why the bronchi becomes bronchioles. They become very, very small, and they connect to the alveoli. And these are your little air sacs. It looks like almost like a little cluster of grapes, if you will. The alveoli, they're microscopic sacs where oxygen and carbon dioxide are exchanged. This is where the magic happens. This is where you actually get the oxygen into the bloodstream and the CO2 out of the bloodstream. So we're bringing oxygen from the upper airways to the lower airways, down through the larynx, all the way down through the trachea, down to the right and left bronchi and to the bronchioles. And from the bronchioles, we make our way to the alveoli. And the alveoli are surrounded by a vasculature system. We'll talk about it later. Is surrounded by arteries and veins. And these capillaries are very, very small. And this is where the oxygen makes its way from the alveoli into the bloodstream, and the CO2 that's in the bloodstream makes its way out of the bloodstream and into the alveoli. And it takes a reverse pathway going back out from the lower airways all the way up to the other upper airways to be exhaled into the atmosphere, right? Let's take a look at this little video. We'll kind of get an idea of how the oxygen molecules move from the bronchioles, all the way to the alveoli. See how everything progressively gets smaller and smaller and smaller. And this oxygen is making its way all the way to the alveoli. And here it is. This is under a microscope. We can see these are the alveoli, and this is where gas exchange is taking place. There are blood vessels that surround these alveoli, and the O2 goes in and the CO2 makes its way out. When we look at the lungs, we have to understand the anatomy. The anatomy is as such. The right lung has 3 lobes and the left lung has 2 lobes. And the reason the right side is bigger is because the heart primarily lays in the left side of the upper chest. So you'll see a test question. It'll say, Of the right and left lung, which lung has more lobes, the right or the left? Well, the right side has 3 lobes, the left side has 2 lobes. And the reason is, like I said, because the heart primarily lies in the left side of the chest. We can see the alveoli here. See that vasculature that is surrounding those air sacs. You see the arterioles, capillaries, and venules, and we'll talk about those when we get into the physiology of the respiratory system. Right now, we're primarily working on the anatomy. And here it is at a very microscopic level. See the red blood cells picking up the oxygen, and the CO2 is making its way out. Yeah, and this is an animation of what it looks like at a very microscopic level. And those are beautiful red blood cells. And those red blood cells, they have what they call hemoglobin. And the hemoglobin has a great affinity, meaning it wants to bind with oxygen. It has a great affinity for oxygen. You ever played with magnets? You know how you put the magnets together and they come together and they snap? Well, the hemoglobin located inside the red blood cell absolutely will snatch up that oxygen in a minute. It loves it. And when the oxygen molecule and the hemoglobin, which is located inside the red blood cell, that's a test question. When they come together, they're called oxyhemoglobin, right? So when you mix 2 things together, it usually takes on a different names. Kind of like, you have peanut butter and then you have jelly, but then you have PBJ once you put it all together, right? It's kind of the same thing here. You have the red blood cell, hemoglobin, and then you have the oxygen molecule. So when you put them together, you have oxyhemoglobin. But remember this will be a test question. Each lung is divided into what? Right side 3 lobes, left side 2 lobes. They both have a bronchial tree all the way down to the alveoli. And remember, test question, what are the little air sacs called? Alveoli, right? And gas exchange occurs in the alveoli through a process called diffusion. And we'll talk a lot more about diffusion as we move on into the next slide.